Hi, I'm Dr. Neil Paulvin. I'm submitting my video for the Functional on 5. My goal is to try to change the paradigm in terms of how patients who have pain syndromes are treated and how their evaluation approach is involved. I also feel that patients need to be more involved and explain the pathology better so they can become more invested in their treatment and ultimately get better quicker and with a more complete recovery. I'm an integrative sports medicine pain management doctor and an osteopathic manipulation physician. I practice in New York and New Jersey. When I see my patients, I kind of tend to categorize my pain patients into two areas. There's the kitchen sink patients and the one bucket patients. The one bucket patients are the patients that come to me and they say they have Lyme disease, they have mold toxicity, they have fibromyalgia, and everything they have, be it a hangnail or a runny nose or pain in their back, is from this one condition. And you have to explain to the patients that you can have multiple conditions that are causing all your symptoms, be it the brain fog, the pain, the problem sleeping, the lack of energy, whatever. It's a lot of times through our evaluation, we're going to find more than one cause, and all those causes are going to have to be treated or to give you long-lasting relief. The other type of patient are the kitchen sink patients. The kitchen sink patients are the patients who come in with a chart that's 6 inches thick. They've seen 15 doctors. They have 10 different diagnoses, and they're on a different treatment regimen for each one of these conditions. They're not getting better, or they're getting a little better. They don't know which things are making them better, which treatments are making them worse, and they're confused and they want answers and they just want to feel better. I don't know if either of these types of approaches are great for these patients. I think the approach needs to change. I tend to break it down more than kind of giving it a label at this point, that's Lyme disease or fibromyalgia. I find that if you break it down into categories that are causing their pain and things that by treating these may help their pain, it helps them more than giving a specific diagnosis, because a lot of people that treat patients with pain, be it a traditional physician or an integrative medicine physician, know that a lot of times there's more than one thing going on, and by giving it 5 different titles, one doctor will call it fibromyalgia, one doctor calls it just a pain syndrome, and they just get confused and they get discouraged and they don't get better. So when I try to break it down for you, break it down for them. I tell them about 9 different things that we're looking at in terms of trying to get better. Yes, I know a lot of doctors will find more categories, but I try to summarize in these 9, and then once they're evaluated and treated, we can go into deeper details with the patients on some of the more not as common things. Obviously, being a functional physician, we always discuss diet, exercise, and sleep. These are usually the core of how we're trying to help these patients. We explain to them that diet is integral to how they get better. Those are the common ones, the basic ones. The other 6 other things that I use to treat these patients are kind of more specialized, I feel. One is the gut. We know the gut is a big deal in all these patients. We explain that it affects their immune system. We explain that it can affect their brain fog, as the brain and the gut are connected through the nervous system. We can explain that because that leaky gut or small intestinal bowel overgrowth may be exacerbating the pains that could actually cause some of their symptoms, if not a lot of their symptoms, and that this needs to be evaluated. The second is inflammation and toxin. These need to be treated. This could be Lyme disease, heavy metals. Those also need to be addressed to help with their pain level. The third is inflammation. Inflammation needs to be addressed. And the inflammation could be, we explain to patients that inflammation are chemicals in the body which exacerbate their pain. Their stress, lack of sleep, and infection all can exacerbate these. So we need to treat the inflammation no matter where it's coming from to make them feel better. It may not be from one specific area, but it may be from multiple areas. We need to treat their immune system. A lot of patients, Lyme disease patients, have a low immune system. Other patients have autoimmunity, and that needs to be addressed. We also need to address their mitochondria and their antioxidants. We explain to them that mitochondria is the energy portion of the cell. If that's not treated, then they are going to have continued fatigue, energy issues, brain issues. The last thing is, we always, as being an osteopath, besides all the integrative things, we need to treat their musculoskeletal and treat their pain complaints with hands-on techniques. Otherwise, they will not get better. Thank you.